old. Katie McCurdy, I'm a patient and also a designer. I'm co-chair of the Medicine X Design Council along with Dennis Boyle, who couldn't be here today. I'm here to announce the grand prize winner of the Healthcare Design Awards, which is a way for us to celebrate and acknowledge excellent design in healthcare. This year, we put out a call for submissions of kind of excellent examples of design in healthcare. We got about 60 responses. We judged those submissions along with members of the Design Council, which is a group of many different designers from all over the world. So when we got these submissions in, we were judging them according to a few different things. We were looking at, did they include a diverse stakeholder mix? Did they show us examples of patient-centered design? Did they address relevant issues in healthcare? Was it an innovative and novel solution? Did they show us a potential or proven ability to improve quality of health? What was their design process like, and how did they really tell the story of their project? So I would like to now announce the grand prize winner. The category this group submitted to was collaboration in healthcare. The winner is the Purple Design Group Purple Team Design Group at Lucile Packard Children's Hospital at Stanford. The topic was schedule-based family-centered rounds, and this is a process change to improve communication and collaboration during rounds. What the judges loved about this submission was they had excellent evidence of their design process. They showed us evidence of varying stakeholder participation. They had wonderful documentation and storytelling, and really an evidence of impact. So the winners are going to take the stage now and tell us a little bit more about their project. So please join me in welcoming two Purple Team members to the stage, Mimi Albert, the project manager, and Dr. Alaina Kipps, medical director of acute care pediatric cardiology at Stanford. Thank you.
There we go.
Waiting for all right. So the healthcare system's really complicated. You all know that. That's why you're here today. And hospital-based care is just one part of an incredibly complicated system. The patient journey is even more complicated once you get into what the patient needs, especially the types of patients we see at Packard.
Being in the hospital is a scary time for patients and families. We're taking care of people at their most vulnerable. Everything we say matters. Everything we do matters. We cannot overstate the impact of every single interaction the healthcare team has with the patient and family. One of the most important lessons I had here at Stanford when I was a resident was from our chaplain. She taught us that parents of a sick child have already had a promise broken because childhood is expected to be a happy, healthy time. She wanted us to be sure to support the patient and family at every step and to never make a promise we could not keep. At Stanford, we practice family-centered care, an innovative approach to the planning and delivery of healthcare. It means patients and their families are not just beneficiaries of our care, they're essential members of our healthcare team. Family-centered rounds are a key component of family-centered care. This is when the entire medical team visits each patient's bedside to discuss the plan of care, talk about the concerns, and to teach. It's the only time of day when the entire team comes together for each patient. Here we have Carla, Carla's mom. Carla's been waiting in Packard for 6 months already for a heart transplant. We have our bedside nurse present for rounds and a group of nurse practitioners helping care for our patients. We're joined by our case manager who really runs the show and keeps us on schedule. We have a Spanish interpreter for this patient. We have our pharmacists, and the rest of the medical team consists of a cardiology fellow, our cardiology attending, consultant attending, and our peds resident.
But sometimes waiting for the team to come on rounds is like waiting for the cable guy. You never know when they're going to show up. There's a 4-hour window. I mean, how many of you have felt like this guy? Like, right? Like when my whole day is wasted. I mean, can you imagine doing this day after day, and it's your child's health at stake? It's not your ability to watch Game of Thrones. Now imagine you're a parent. Your baby just had heart surgery, and the only time that you get to talk to your child's entire healthcare team is in the morning between about 8:30 a.m. and noon. You have no idea when they'll be by. You're hungry, you're tired, maybe you just need to go to the bathroom, but you don't leave because you don't want to miss a chance to talk to the team. Or maybe you're a nurse. You need to tell the team about how the patient did overnight, and it's important for the attending and resident to know your concerns. You have a question for the pharmacist, but you happen to be giving meds to another patient on the unit, and you miss the team at rounds. Or you're a fellow. You want to be present during rounds and get some teaching in, but you're being paged from consults, from other services, and you keep having to step out. You depend on the resident to catch you up, but it's no substitution for being there. You're scared you're going to miss something and hurt a child. Or you're the attending. You need to tell the parents some important news, but they don't speak English, and you haven't taken Spanish since high school. You paged the interpreter to come, but you got stuck on the last patient and you missed them. The interpreter left, you'll have to page them again, and there's no telling if they'll be able to come back.
So how do we take this system, very complex environment, filled with complete chaos and unpredictability, and create some order and harmony? We need people to be in the same place at the same time. We have this saying at Packard, it's like one message, one time, let's all be there at once. Clinics have schedules to see patients. Even really complex multidisciplinary clinics have schedules. So let's make a schedule. But let's not compromise another central mission of the School of Medicine, to teach. In fact, let's explicitly build it into our schedule.
So when we say everyone was included in this human-centered design project, we mean everyone was included. We talked to this entire list of people to really get their buy-in and what they needed from this process to make it work and to make it work better. But the people that we really included and that we needed to make it work for at the end of the day were our patients. So at Packard, it's really great. We have local improvement teams that include a parent rep. We also have a family advisory council, which is made up of parents who have had kids in the hospital. And we gave out surveys on the unit to get a better sense of what patients and families needed and expected from rounds. This helped us make sure we were always on the right track.
So with everybody's input, we designed this system to produce and publish a schedule for rounds every morning, including weekends. It's posted early enough so our nurses can sign up for their rounds, sign up for their breaks so that they can be on rounds for their patients. The medical team knows when to be at each bedside. Our consultants know when to be at each bedside when needed. Interpreters show up right on time. And families now know when to expect bedside rounds, benefiting from having the entire team together, communicating and collaborating to make their child well. So we make a daily promise to these families that we will come at a specific time, and unlike the cable guy, we show up.
Thank you.
So thanks to the rest of our core team.
And the many other people.
And Medicine X.
And Medicine X.